All right, welcome everyone to another First Principles episode. This is going to be a fun one. There aren't really any first principles for this one because the topic we're going to be talking about today is about mnemonics, and mnemonics don't really rely on any first principles. They rely on sheer brute force memory, and sometimes they don't make any fucking sense, as we'll find out today. So we've got some fun guests that are coming back with us today. We've all passed our exams. Congratulations, everyone. You want to introduce yourself, Broska, Josh, and Mike?
Yeah, well, I think you just did, but my name is Broska.
And this is Josh.
And I'm Michael.
Lovely. And we have Jason sitting in the background. So, as I introduced earlier, this topic will be about mnemonics. And I guess the whole framework here today is I'll give you a few clinical headings that we can bounce off of. And if someone says a mnemonic that is, jogs a bit of a memory, that you have some other a better mnemonic, then please jump in and say why your mnemonic is better, or we can just keep going with that category until we exhaust our mnemonics. Sound fair? Sweet. Now, because it's my episode, and I always like to talk about the definition and etymology of words, so mnemonics. The definition of mnemonics, does anyone know? Anyhow, I only just found out 2 hours ago that mnemonics actually means the study and development of systems for improving and assisting memory. So it's not just the word I thought mnemonics was acronyms. So using A, B, C, D, E or something. That's a form of a mnemonic, but the specific term for it is acronym. But there are different other types of mnemonics, such as acronyms. There's also songs and rhyme, like poetry, I guess. You can think of chunking, and there's a fifth one called memory palace. I'm not sure if anyone uses that here, but these are different types of mnemonics. Anyhow, so let's just move on. A bit of background there. Okay, so let's just bounce off from the first topic, which will be clinical skills. Okay, and I'll start off. History taking, this is probably the first mnemonic in medicine I've learned, was Socrates, okay? But I use a different form, which is Socrates, not just Socrates, because S for site, O for onset, C for character, R for radiation, A for associated symptoms, T for time, I for impact on life, E for exacerbating and alleviating, and S for severity. Anyhow, so that's a popular one. Does anyone want to jump in?
For history taking, I think for like the pediatric one, there's BINDS. It's BINDS. The B is for birth. So you ask questions about before the birth, during the birth, after the birth. Then the I is immunizations. The N is for nutrition, so their input and output. The D is for development if they're reaching milestones. And then the S is social history, so who's at home and so on.
Lovely. Thank you.
Does anyone have any more like OBSCI and PEDSI related ones?
I use the SMOCC. SMOCC, so S being sexual, M being menstrual, O being obstetric, first C being contraception, and the other C being CST.
I remember you telling me something about like 9 Ps, Josh.
Yes,
do you want to do that?
So my sexual history, I used the 9 Ps. The first 3 Ps are, the first one is preference. So male, women, non-specific. Then it's practices, anal, oral, vaginal. And then the third one is protection. Do you use barrier contraceptives? The next 3 kind of revolve around infections. So 2 symptoms would be things like pus and pain, and then past STIs. And then the final 3 is kind of like a risk assessment. So I have plans for pregnancy, needs for protection in terms of emergency contraception, and my last P is payment. Do you ever get paid for sex? And then my S on the end of the 9 Ps is for safety.
Yeah.
Yeah.
And the good thing about mnemonics is you don't have to use all of them, but you can. But I actually think that's pretty good, like having like maybe SMOCC, and then in the sexual history you can write like a 3 or 4 of those Ps.
Yeah, there are a
down
few
if you have,
Ps.
like,
Well, I actually do 5 Ps, so just their preferences, male, female, their practices, so oral, anal, vaginal, whatever it might be, protection, so do they use condoms, presenting symptoms, so what symptoms do they have, so I throw all your pus and pain and everything just under 1 P, and then past STIs. That's enough for me.
I only realized, I think last year I was like, I'm not going to remember SMOCC or BINDS, but then I had to come back to that this year because it was just a good framework to use. In trauma, there's 2 that I use. There's AMPLE and MIST. So AMPLE is allergies, medication, past medical, last time eat or drink, and E for events of the issue of the thing. And then MIST would be mechanism, investigations, signs, and Fuck it, I don't remember what missed
actually- I
was.
actually
This
feel like
is
it's
mechanism,
injuries.
injuries, signs, and treatment. That's
Treatment,
fine.
yep, sweet.
I also do ample. Yeah, I do ample T, and then the T is just tetanus. Just check that, and then
Yeah, nice.
and then for events, just to add that. So for the E events, like just always remembering like for any kind of trauma case, it's always appropriate to do before, during, and after, and just.
Yeah, nice. Okay. Jason just mentioned one. WAFL or waste is one that I've used for red flags or constitutional symptoms for cancer. And so if it's waste, would be a weight change. A for appetite, S for sleep disturbance, usually night sweats. T for changes in temperature, and E for energy, so like fatigue. But WAFL, WAFL, is a very similar one.
I reckon kind of coming off waste, which, cancer presentations often come up in your GP stations. Yeah. And one to remember always for your GP stations would be the ICE, which is a nice, easy one. Ideas, concerns, expectations.
All right, so we moved on to communication. I put that under communication. So, Broska, you want to jump in? What did you have there?
Yeah, I got some good ones. So, for explaining prescriptions, so explaining medication prescriptions, MADCAMS. So
Not reads. Not reads.
Reads is for every
Garbage.
other one.
I use two A's, so I go REAADS. So R is the rationale for the drug. E is education on how to take it. So like it's an oral tablet, you take it every day. This is how long you'll be on it for. First A for allergies. Second A that do is appropriate baseline investigations. So for like a SSRI, that might mean doing like a mood questionnaire when you start it, so then you can do another one in 3 months' time, or doing a ECG because it causes QT prolongation or this or whatever it might be. And then D for drug-drug interactions, and then S for side effects, and you can throw in another S for safety net if you want to.
So my one for prescribing drugs, MADCAMS, so MADCAMS. So the first M is for like the mechanism of action of the drugs. A is administration, so how and when you take the drugs. And then D is duration, so is this something you're going to be taking for a few weeks? The C is so contraindication screen. The A is for the adverse effects. M is for monitoring, so with different drugs you can need to monitor like what their kidney function is, apixaban and so on. And then S is just safety netting. Safety netting sometimes is just included in the adverse effects because you're kind of describing it and telling them to look out for it. But yeah, so that's my one.
I hate that.
No, that's so good. That's God tier. God tier.
Yeah, it's very good.
Yeah, it's very good.
Does anyone use athletics?
Athletics is
No, athletics is garbage. We steer
Yeah.
away
We'll put it
from
in, but
athletics.
no one uses it.
Yeah, supplementary information. What the fuck does that mean? Anyway, I have another one. So this is for explaining diagnoses, and it's UMS RCP. So UMS and then RCP. The U is for understanding, M for mechanism, S is for signs and symptoms, R is for risk factors, C is for complications if untreated, and then P is for prognosis. So prognosis is pretty much like if it's just mentioning if they have diabetes or asthma or something, that this is a chronic disease you're going to live with. We aim to treat rather than cure.
I've got a similar one there. This is more so for just learning a condition, and which might help with, I guess, explaining the condition to the patient. DAMPSITE. So D for DAMPSITE. D for definition, A for etiology, M for mechanism, P for pathophys, S for signs and symptoms, I for investigations, T for treatment, and the last E is epidemiology, if you want to just throw that in. But that's an RMO taught me this to be this is how you should explain a condition. If a consultant asks you, it'll be what is OA, osteoarthritis? So you're not just saying whatever's in your head, at least you have a structure to it. Any other communication things? We've heard of spikes, nurses. I think that's quite universal, right?
Yeah.
Yeah.
I guess it's the STAR one. Did you... I heard about STAR.
Oh,
from,
I've heard of this, yep.
For non-farm management for quitting smoking.
Yeah.
And just counselling them. So, yeah, it's STAR. S is set a date. T is tell family and friends so they can be supportive. A is anticipate challenges. So if they relapse, then to not be discouraged by that. And then R is to remove all tobacco products. And you can kind of use it for alcohol counselling as well.
Kind of going off of the smoking counselling as well. Have you guys heard of the 4 Ds for your non-farm kind of advice?
I've heard of the 5 A's.
Yeah, the
very,
five.
very phallic. Kind
Yeah,
of,
yeah.
like mnemonics.
That's
Yeah.
kind of that's what I go off of. So the 4 Ds, it's basically your throwaway advice to like.
Oh, I have
people.
heard of this. This is good,
Yeah,
actually.
yeah, for people who are trying to quit smoking. So the 4 Ds, the first D is delay time between cigarettes. Try deep breathing, drink water, and the final D is to do something else, like go for a walk.
I guess while we're here, this is similar, like in the history, would be SNAP W. I used to just do SNAP, but then I always forgot about W. So S for smoking, N for nutrition, A for alcohol, P for physical activity, and W for weight. Because I just always thought if you did physical activity and nutrition, you'd lose weight. But you have to make it so explicit because you need to take off that marks.
And that's a good one to have because like I wrote that on pretty much every station because if you're ever like really struggling for advice to give a patient for your management, you can always advise them to stop smoking, reduce your alcohol, lose weight, increase your exercise, and fix your diet. There's still one more for communication.
Oh,
For PRBRACCC.
Oh,
yeah,
yeah,
that's
so
like
heard,
literally
yes.
the best one
Yes,
I've
yes,
ever
yes,
heard.
yes. That is the best one, yeah.
And I heard it from you, so you should
I
say.
did a bit of an addition to like the conventional PRBRACCC. So this is for like consenting patients for procedures. So I think typically it's just PRBRACCC, and it's like procedure, rationale, benefits, risks,
Alternatives
and then just consent.
and contraindications.
And the last, I do a D, which is document.
It's a
Nice.
T.
Yeah, I do it ending in 3 C's, so it goes so it goes contraindications, concerns, and consent are the final 3.
Detecting a theme with Josh's remarks.
Dude, I just like if I have one, I just run with it.
Yeah.
This isn't a mnemonic, but I think when we were studying Aussies throughout the year, me and Cam Kaiser and Lewis Sampson, we were sort of trying to think about where you're going to be in a setting, and typically you're only really going to be in 3 places if you're taking your history when you're doing an OSCE. So we thought you either be in the ED, like on the ward, or in a GP practice. Yeah. So then we sort of just came up with mnemonics or stuff to write down on our page for that setting to remind us of the key stuff that we would want to talk about. So like for an ED setting, for example, every single time I do an ED station, I just write at the bottom of the page, just go AAA, BBB, and then CDEFG. So it's like antiemetics, antibiotics, analgesia, bloods, breathing, so like oxygen, bladder for like IDC, and then C for cannulas, D for DVT prophylaxis, E for like enteral, like nil by mouth, F for fluids, and G for glucose. And it's just something that you scribble down on your page. So obviously you need to like know what you're talking about first, like talk about the condition. But it was just something to be like a reminder to have a look down and be like, have I missed any of this stuff? Because that's the stuff that you want to mention in an ED setting. Like you have to know where you are. That's like your limitation of where you are. And then like your disposition as well from there. But that's something that we'd scribble down for every ED station.
That's
quite
very
nice,
good.
actually.
That's
That's
very
quite
good.
nice, yeah.
Yeah.
Jason, did you want to jump in? What was your DFS?
Purposes of OSCEs, anytime you finish management, you should always finish it off with DFS. So D stands for disposition, F for follow-up, and S for safety net. So depending on any setting, you just always think of either one of those 3 things are going to be applicable.
Yeah, sweet. This one probably links in with your you said you were 3 settings, right? So ED is one, GP is another.
So GP is another one.
Yeah.
So the one that we use for GP, Lewis came up with, and it was SNAPFRESH. So S was for screening. So that might be your classic screening stuff that you think about, like CSTs or mammograms or whatever, but it could also be like calculating their 5-year cardiovascular risk, for example. N was the non-pharm, so then that's just your classic smoking, alcohol, nutrition, physical activity. And then A was action plans. So like if someone, if they need a GP management plan, or if they can be eligible for like a team care arrangement or something. And then P was for pharmacological stuff. And then F for follow-up, R for referrals, E for inquiring, like any questions, S for safety net, and H for handout. And that's just what we'd scribble down on our GP ones to make sure that we didn't miss anything.
Yeah. It's
Comprehensive.
That's a good one.
And it's a good approach like for when you don't know like what the heck you're talking about. You can still get points if you don't know what the specific management is. Yeah. If you throw out like a comprehensive list of stuff.
Have you guys heard of EINPPALS? Have you? EINPPALS. So E for education, I for investigations, N for non-pharm, P for pharm. The other P is preventative health, so the screening that you mentioned earlier. A for allied health referrals, L for logistics, so like MedCert, RFDS, PATS, and then S for safety net and follow-up. And then I guess your last one is rural. Is that right? Or
The last one was like an in hospital setting, like
inpatient.
a reviewing a patient on the
Yeah,
ward sort of
okay.
thing.
Yeah.
But Geeky Medics had this one like SHENBOXED. SH was like the summary of the history. It's like revisiting the history. The E was the examination. B was like bedside investigations. O was for orifices, I think, like like any swabs or anything that you needed to do, which actually was a good reminder of like if there any like if they have an IDC inserted or if they have like a cannula or something to check those lines, and then X for like X-rays, so imaging, and then E for an escalation plan, so like if you were talking to a nurse or something like that, and then D for like documentation. And then we changed it to SHENBOXED, so we just added in an N for notes, so just to take a look at like any medication charts they had or like fluid balance charts or anything like that.
there's always a point for that, right? It's so obvious, but everyone forgets. Yeah.
And sometimes for like those OSCE stations where you ask to review a patient, the prompt kind of goes, you're going to get a handover from a nurse beforehand.
Yeah.
It seems super obvious to me now, but in the start I didn't really have any approach to that, but just like purposefully using an ISO bar format and how you ask the questions of the nurse to get that history from them is very useful, I found.
While we're talking about inpatient, does anyone have a preparation for theater checklist they want to share? The one I use is Pacific with 2 Fs, PICIFFIC. So P for prophylaxis, which includes VTE, antibiotics, analgesia, antiemetics. A for anesthesia review, contact the DA. C for consent the patient. I for IV access, IV bloods, so the surgical bloods. F for fast the patient. F for fluids. I for imaging. And then C, call the wards, book the theater, post-op bed. All right, we're doing exams now. This one is courtesy of Dev, who taught me this in one of the MD2 toots. The exam for a neurological exam is I took pills on RCS. So I for inspect, T for tone, P for power, skip the on, R for reflex, C for coordination, and S for sensation.
I have a better one. That's
All right.
that's not drug themed.
And maybe also not like UWA themed for our international listeners.
And also you don't have to skip this on business.
Yeah.
I think Pavarotti really can sing.
That's
good.
Yeah.
That's good, right? Yeah.
That's good.
I think
And it's crazy how often I'm just like saying that to myself whenever I'm examining a patient. Just like
I
Pavarotti is the best fucking singer. Like,
who is Pavarotti?
he's an Italian opera singer. Like,
Oh, Pavarotti.
yeah.
I don't fucking know.
Come on, guys.
Michael, do you have anything?
Syllables in it?
Just the Swift, for which everyone uses for like lower limb or upper limb neuro exam, just when you're having a general inspection. So scars, wasting for muscle wasting, involuntary movements, fasciculations, and tremor.
Yeah, nice.
Oh, that's
Yeah,
a good one.
That's a common one.
Yeah. This is actually, I think this one's all right. So it's not for neuro, but it's for like your joint exams like hip and knee. For the observation, I use Dr. Mess, which is D for deformity, R for resting position, M for muscle wastage, E for erythema, S for scars, and S for swelling.
I actually like that.
Yeah.
So there's a GI one I use, BDSM. For B for bruising.
Why do we keep going back to this?
D for distension. S for scars, spider nevi, whatever that crap. And M for, I guess, like abnormal movements or pulsations on the abdomen.
To remember which murmurs are like accentuated with expiration or inspiration is the mnemonic RIAL. So right-sided murmurs are accentuated with inspiration, whereas left-sided murmurs are accentuated with expiration.
That's pretty good.
I came up with this one for MSKs, like
Yeah.
look, feel, move. So that was a pretty good one.
Really good one. Wait, can you repeat that? Look, now can
That's
you...
groundbreaking.
Yeah, and then... So look...
Oh, I actually do have one for that.
No, I can cut that.
For look,
Yeah.
feel, move.
It's going to be good as
have-
well.
It's gonna be
It's going to be a good one.
I have no, it's actually like reaffirming. It's I feel mighty special
Oh, that's cute.
for inspection, feel, movements, and special tests.
Yeah.
I feel mighty stupid listening to this.
Build morale.
All right, sure. This one's common. Danish for cerebellar signs, right?
Oh,
Come
that
on.
is a good
yeah.
one.
D for well,
So D for dysdiadochokinesis, A for ataxia, N for nystagmus, I for intention tremor, S for speech,
slurred speech.
slurred speech,
Yeah.
and H for
Hypotonia. Hypotonia, yes. All right, shall we move on? We finished all the clinical skills. Now let's just jump into like medicine. All right, let's do emergency medicine.
So for the high anion gap metabolic acidosis, the causes can be remembered by left total knee replacement. L stands for lactate, T for toxins, K for ketones, and R for renal loss. And then what's
Renal failure.
That's actually a good one to know.
Yeah,
I
and
reckon.
then the other one for a normal anion gap or NAGMA, that's A, B, C, D.
A for Addison's, B for bicarb loss, C for chloride excess, and D for drugs.
Yeah, great.
While we're on VBGs, this one's not really mnemonics, but this is just like somehow they all seem to match. So the normal range for pH and for sodium and CO2 is always 35 to 45. So if it's pH 7.35 to 7.45, sodium 135 to 145, and PCO2 is 35 to 45
millimeters of mercury.
Indications for acute dialysis, AEIOU.
I
That's
like
a good
that.
one.
I like that.
So the A is acidosis, E electrolyte abnormalities, I is intoxication, O is overload, so fluid overload, and then U is uremic symptoms. That's a
Yeah, I
good
like
one.
that one as well.
Someone give me myocardial infarctions. How do you manage it?
Romance.
Yeah, romance is good.
I'm a romance guy.
Yeah.
I'm sorry.
So yeah, if you wanna go. Also, people
no,
really
please.
people downplay like so it's romance and the first R is reassure, and I used to downplay like this little counselling thing, but when you're doing an OSCE, just having like the that little
Like, I know this
gets
is
you
hard.
points. Yeah, like this must be really difficult. Like in a complete completely
Perry
monotonous
arrest.
voice.
Perry arrest. Like, I know
I
this
can
must be
un-
quite hard for you.
I can understand that this is really difficult for you. Anyway, so R reassure. O is oxygen supplementation. M is morphine. A is aspirin. N is nitrates. C is clopidogrel, but really it's ticagrelor. And then E is enoxaparin.
What's secondary prevention of MI?
Yeah, so it's Monobash, the conventional one is, so it's morphine, oxygen, nitrates, aspirin, and then Bash is beta blockers, ACE inhibitor,
Yeah.
statin,
Yeah, that's right.
and heparin.
Yeah, that's right. Yeah. Cardiology, anything else? APO?
Yeah, this is a nice one.
There's 2 for APO at least.
Let's go in a logical order. So for chest X-ray,
Yeah.
for APO, you have A, B, C, D, E. So A is alveolar opacification.
Yeah.
B is curly B lines. C is for cardiomegaly. D is for dilated upper zone vessels.
Divergence to upper lobes.
That one.
I think it's also diverted up. I think there's a few different words
Yeah.
that they have for each
Yeah.
of them.
And then E is for effusion, so your plural effusions.
You don't really need to know what any of these words mean. You just say them.
Yeah.
Say them
And
on
then
the
you
X-ray. You
sound
can't even
smart.
see
You
it.
just say them and then smile confidently.
Yeah.
No, there's no way that I'd know if
There was
there's been
dilate.
divergence to upper
Yeah.
lobe.
Do you want to finish the LMNOP one?
Yeah, the element P one was a good way to learn the management of APO. L is for Lasix, M is for morphine, N is for GTN, O is for oxygen, and P is for position to sit them up at 45 degrees.
Also, little fun fact. You know why they call it Lasix is like the name for frusemide in America. You know why they call frusemide Lasix? Lasts for 6 hours.
Oh,
It's a fun little fact.
That's not so.
No fucking way.
Yeah.
really?
Oh, you better believe it, buddy. Yeah, it's pretty good.
Do we have any other cardiology ones? There's one for absolute cardiovascular risk calculation in Australia, I think. Would be gas death. So G is for gender male. Age is for 35 to 74. S for systolic blood pressure and smoking. D for diabetes. E for ECG, showing left ventricular hypertrophy. T for total cholesterol. And H for high cholesterol being low.
I have one more for cardiology. It's for symptoms of bacterial endocarditis.
Oh, I
And
like
it's-
that. Yep.
And it's from Jane.
Yes.
So F for fever, R for Roth spots, O for Osler's nodes, M for murmur, yeah, J for Janeway lesions, A for anemia, yeah, N is for nail bed hemorrhages,
That's right. Splinter.
and
hemorrhage.
E is embolism. It's not really a symptom, is it? It's not really,
Are those
I guess
clinical
there's
features?
signs and symptoms as
Yeah,
well, and
yeah.
it's still not really a sign, but doesn't matter. Just I actually think they're the minor criteria as well.
Lots for cardiology now I think about it.
So for AF, if you listen to our episode, C would be cause, A for anticoagulation, and R for rate or rhythm control.
Yeah.
The risk stratification for stroke, if you have AF, would be the CHADS-2-VASc score, and these are commonly used in the hospitals too, not just student-made ones. And then risk of stroke post-TIA would be A, B, C, D, 2.
I think my AF one is better.
All right, let's hear it.
So I use TRAM, T for triggers, R for rate, R for rhythm control, A for anticoagulation, and M for monitor for complications such as stroke and MI. Tram's pretty good. I reckon that's
Fair
pretty,
enough.
that's
I do
pretty
like
good.
that. I do like that.
Rheumatic fever, I reckon the Jones.
Oh, Jones.
Oh,
that
that's
one's
a good
fun.
one.
Yeah.
Yeah.
All right.
J for joints, so like a polymigratory arthritis. The O is like the heart symbol for the endocarditis, myocarditis, pancarditis. N for nodules, so subcutaneous nodules. E for erythema marginatum, like that annular rash. And then S for Sydenham's chorea, which is the involuntary movements.
Sweet.
Centaur is what makes you suspect someone has a strep pyogenes cause of sore throat,
CENTOR.
which is C for cough absent, E for exudate on the tonsils, N for tender cervical lymphadenopathy, T for temperature, and then OR was age.
You get a point if it's less than 14, I think, and if it's more than some other, you get -1, actually. Yeah. Right. Let's move on to endocrine. This is a probably common one too. Bones, stone, groans, moans, and thrones. Clinical features of what, Josh?
Hypercalcemia.
Hyper, yeah. So bones for bone pain, stones for commonly renal stones, but I think gallstones included too. Groans for abdominal cramping, nausea, vomiting. Moans for like psychiatric moans, like depression, confusion, lethargy. Thrones for because you have your throne and you're having a polyuria would be.
The throne is a toilet. I got a for the effects of cortisol. I have a big fib.
Cushingoid. I thought that was the mnemonic you were going to use.
Oh no, Cushingoid is better than this.
Yeah,
This is a bad
yeah,
one.
So let's just quickly do Cushingoid.
Yeah.
So for the side effects of corticosteroids or what you'd expect to see in someone with Cushing syndrome, you can use the mnemonic or the acronym Cushingoid, which is C for cataracts, U for ulcers, S for striae or skin thinning, H for hypertension or hirsutism, I for infections or immunosuppression, N for necrosis of the femoral head, G for glucose elevation, so hyperglycemia, O for osteoporosis or obesity, I for insomnia, and D for depression or diabetes.
I have one for diabetes annual cycle of care. This one's long, but diabetes is
Long
very
ones are the
important.
best ones.
So glucose bad.
Hi.
Glucose bad is the mnemonic.
Why are we so simple?
Yeah.
G for glycemic control, so you want to check their BSL, HbA1c. L for lipid control, so bloods and statins. U for urine, ACR, and their EGFR. C for cigarettes, alcohol, and their mental health. O for optometry. X for sexual dysfunction. And because sexual is activity, I also put physical activity there. E for extremities, so you do their 10-gram monofilament thing. B for blood pressure. A for aspirin if their CVD risk is moderate or high. And then the last D is dietitian, diabetes educator, and dental checkup. So 3 Ds at the end, Josh, just for you.
Anyway, 2 random ones I thought of, they're not related to this topic, were for Kawasaki disease, crash burn. So C is...
Crash and burn.
Crash and burn. Anyway, I can't remember exactly, but that's a useful one.
I can remember it.
Yeah, but I don't care. You'll take 10 minutes to speak it out. And the second one for clinical exams is...
It's now you know this is without explaining the mnemonic. We're just bragging that you know a mnemonic.
Okay.
It's just you just
Okay, fine then. For crash burn, it's...
it's conjunctivitis.
Oh no, conjunctival injection actually. Not R for rash, A for adenopathy or lymphadenopathy. Adenopathy. Oh my god, I
Dude,
couldn't.
cut this out. Let's
Anyway,
just.
S
I have
is
I
for
have some good ones.
Strawberry.
strawberry tongue. Yeah. H is hands.
Edema in the hands and
Yeah,
feet.
and burn is for like fever for a few
38
days.
degrees.
Kankezi taught me one for like the coagulation cascade.
Oh, yes.
Oh yeah, that's important.
Yeah, very
TV
important.
channels?
Yeah.
No, not TV channels. So like the APTT and the PT.
Yeah.
So like the extrinsic pathway, play tennis because you play tennis outside. So extrinsic pathway is PT. But intrinsic pathway is play table tennis because you play table tennis inside. So intrinsic pathway is APTT.
Nice.
So psychiatry, there's a ton of mnemonics there for the DSM-5,
yeah.
if you remember this. And if you're an MD2, just remember some of these mnemonics because it definitely shows up in the fucking writtens.
Yeah, I feel like the psych ones is like, everyone will have like slightly different ones, and you just need a mnemonic for every condition, and there is one for every single one.
Yeah.
And it'll be on the 1PM website.
Should we talk about a few or?
Okay, let's just all go around the table saying our cycling. So, all right, so starting with probably the most high yield ones, we'll start with depression. So I use siege caps. So S for sleep disturbance, I for loss of interest, so anhedonia, G for guilty thoughts, E for energy changes, C for concentration difficulty, A for appetite, usually appetite loss, P for psychomotor changes, could be retarded or agitated, and S for self-harm and suicidality.
All right. The one I have for anxiety is watchers. So WA is for worry and anxiety. T for tension, muscle tension. C for concentration. H for hyper arousal. E for energy. R for restlessness. And S for sleep disturbance.
Nice.
So that's anxiety.
So for the DSM-5 criteria for mania, you can use dig fast with 2 A's. So D for distractibility, I for insomnia, G for grandiosity, F for flight of ideas, A for activity, specifically goal-directed activity. The second A is for agitation, S for speech, and T for thoughtlessness.
I have 7 S's for the side effects of SSRIs.
Oh, yes.
Fantastic.
So stomach upset, so like nausea and vomiting, sexual dysfunction, reduced libido, sleep difficulties like insomnia, suicidal thoughts, which can increase in the first 2 weeks when you start taking it, stress, like anxiety, size, so weight gain, and serotonin syndrome. See, that one, even though there's lots of S's there, Josh, that one works because... that one works because...
Let me explain to you why that one
there's
works.
7 S's for SSRI. See, that's sort of, it all plays into it.
Because
plays into each
because
other.
I guess there are lots of S's and SSRI. I guess so.
I've tried to remember that one, but it just hasn't stuck.
I have one for while we're on psych, PTSD criteria. So dreams for post-traumatic stress disorder. So D is disinterest in usual activities. R is for re-experiencing the event or reckless behavior. E is for there's an event preceding the symptoms. A is avoidance of associated stimuli / angry outbursts. M is a month or more of symptoms. And then S is sympathetic arousal, so like hypervigilance and sleep disturbance.
EPD often have quite like volatile, relationships, right? They have a lot of like battles. So my mnemonic is airfields because I'm thinking of like with the wartime and like
Clearly.
Airfields for EPD diagnostic criteria. A for anger issues, I for impulsivity, R for relationship issues, F for fear of abandonment, I for identity issues, E for emptiness, L for labile mood, D for dissociative symptoms, and S for suicidal behaviour. Not as shit, right? Not so bad. Thank you.
5 out of 10.
Schizophrenia, I reckon that's a good one. For the DSM-5 diagnostic criteria of schizophrenia, you can remember delusions hold such bad news. D for delusions. H in hold for hallucinations. S in such for speech disorganisation, so they could be tangential, incoherent, circumstantial. The B in bad stands for behaviour is disorganised, erratic or catatonic. And the N in news stands for the negative symptoms, which are the 5 A's, asociality, anhedonia, alogia, affective blunting, and avolition.
Dude,
I did. That was levels. I had levels within levels.
That's actually fucking arguably, that's like a hell important one.
Yeah,
Like,
alright, yeah, fucking
schizophrenia.
fucking bite me, Adian.
Yeah. It almost parallels some like actual thinking.
I'm actually out. Does anyone have any more other categories?
My 2 takeaways would be, 1, if you make your own mnemonics, then you're putting some contextual significance to them and you're more likely to remember them for yourself, because obviously a lot of the ones that we've said today are complete shit. And 2 would be like when using mnemonics for OSCEs and that sort of thing, it's something to throw on the page to help you out, but you still have to read a task or still do what's being asked of you and then have that on your page as like a booster.
Yeah.
But don't just rely on mnemonics.
Yeah, definitely.
Clearly, after the Genius Brigade, I've just sat for an hour here listing off 9Ps and
It's good.
Mad Hunger.
It's good.
Yeah. Mad Hunger was fine. Mad Hunger was actually good, in fact. I remember who said it. I can't remember whose idea it was.
My key takeaways are that you can, in fact, pass medical school just by remembering mnemonics,
Yeah.
and you can be as thick as bricks, as thick as shit.
Yeah.
You can get through it.
Yeah.
Hard work and mnemonics.
Yeah, I reckon kind of what Michael said. It is good to like kind of come up with your own mnemonics, and also you can like reorganize the letters into something that makes more sense for you. Get rid of the ones that don't, and then
Or just don't ever share them.
and don't share. If you come up with a good one, don't share, because that's a strategic advantage that you'll have wherever your peers, and it's important to have that kind of relationship if you want to get ahead. And getting ahead's all that matters. You don't need friends at the end of the day. At the end of the day, you need power. And the
Money.
key to power is mnemonics. And
Do you have
being-
a mnemonic to that? 21 rules of power.
yeah, it's fake. The F stands for fuck off. The A stands for anhedonia. I don't know.
Yeah, I don't really have a takeaway. This is just fun time for us to share our things together. Keep it online. Hopefully, one of you listeners will have listened to these mnemonics, and I reckon the best thing they're probably best for is for the written exams, for the MUQs, because usually it's a page turner, 6 marks for 6 features of hepatic cirrhosis, or 6 features of predictors of decline that you have in your 4th year exams. So just remember them for the exam, and then you can move on with your life, because you'll never have to touch them again.
Yeah,
Because
true.
fuck these mnemonics.
One of the things that I only really started to appreciate was just at the very end, just approaching OSCEs, how much I would end up relying on mnemonics, because you just fucking cling to anything that'll help jog your memory, and they become a lot, even old ones that used to suck, you end up being like, oh, that's actually pretty good. Yeah, they can be good.
Some
And
will stand the test of time.
And if you have any nice mnemonics,
Yeah.
make
Put-
sure to send them through.
Yeah, we're gonna
because
read them.
I at least will use them.
As an intern.
Yeah.
Thank you, everyone. Thanks for tuning in to these special episodes. Good luck for your OSCEs coming soon. Maybe you'll see us around.
Maybe.
Yeah. Ciao. Thanks.
Genius Brigade, I've just sat for an hour listing off 9Ps.